Number one thing, don't take advice from some asshole on the radio.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of golly. Oh.
It's going to be a good one.
Broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Tacey, my wife, Tacey, the delightful wife who is my wife. Hello, Tacey.
Hello.
This is a show for people who would never listen to a medical show on the radio or the internet. If you've got a question, you're embarrassed to take your regular medical provider. If you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POO-HEAD, because Tacey doesn't want to say poo-head. Visit our website at drsteve.com for podcast medical news and stuff you can buy, or go to our merchandise store at cafepress.com/weirdmedicine, where you can get a Bristol stool scale mug and rate your stools while you're looking at, your mug while you're sitting on the pot. It is disgusting. And we make 25 cents, so don't worry about it, but it is funny. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. So please do not forget to use stuff.drsteve.com at your earliest convenience, stuff.drsteve.com. You can click right through and go to Amazon, or you can scroll down and look at things that we talk about on this show. Also, tweakedaudio.com, offer code FLUID, F-L-U-I-D. You get 33% off the best earbuds for the price on the market. You can't beat that. And if you want to lose weight with Tacey and me, Tacey's now doing it.
Back on it.
Noom.drsteve.com, Noom.drsteve.com. You get 20% off if you decide to do it, but you get 2 weeks free to try it out and see if you like it. Not a diet, psychology program, and you get a counselor, you get a group counselor. It's little micro goals, and it changes your habits. I'm now, if I binge on something, I binge on rice cakes, and I like it. I actually prefer it to binging on Snickers, which is what I used to binge on. And I was at 200 pounds, and now I'm down at 160 something. So noom.drsteve.com. And if you want archives of this show, go to drsteve.com, and there's a link on there you can click on to get an archive of the show. All the old shows now have gone away because of Matt Kleinschmidt buying Riotcast, and now we are the Laugh Button, and they went to a different platform, and my website is no longer functional. So we're working on that. Episodes 300 and above will still be free, but everything below that, the only way you'll be able to get it is to get archives. So, and if you had a premium subscription, you will no longer be charged for that. And thank you for those of you who did. And there were actually quite a few who were doing that, and that was, that's awesome. Your support never has gone unappreciated. All right? Yeah, so you don't find it fun that you have a husband that's 65 years old in 12 days, and he picked out the number 347 poo.
I've said this many times. I did not know what I was getting into. You were a nice guy. I loved you, and I did not know the weirdo thing. If these people could see this third floor that we have up here. Oh, you love it. I love it.
No, it is. It's pretty fucked up. It's better than it was, but I've still got a lot of work to do. But when we have a weekend and I have to, I want to hang out with you. I don't I don't want to be up here working. So after 15 years, I've basically done nothing.
Yeah. Well, I agree. I would rather you be hanging out with me, too.
But if you go out of town, next time you go out of town, I've got a couple recording sessions I got to do, and I'm going to finish this third floor.
I've been out of town plenty.
Well, I know I had other things to do those times. So I'm going to do it this time.
Well, I think
I used to have, it used to be vomiting nerd stuff in here.
It looks like we just moved in, and we've lived here 15 years.
Well, yeah, everything's out of boxes, but it used to literally look like the bookshelf was vomiting out, action figures and stuff. So that's all gone.
Mm-hmm. But it's.
And the problem is I sold off on eBay all the stuff I could get a lot of money for, and now I'm left with the stuff that it's a big pain in the ass to ship it to somebody, and I might get $10 for it.
Just donate it.
Well.
No.
It's valuable. Okay, well, if I can find somebody who'll take it, I'll donate it to them.
I'm not going to tell you what to do with
fine.
all
you're not
of your
wrong.
Stuff, all of it.
You're not wrong. But anyway, yeah, so that's neither
I mean,
here
a
nor there.
$10 thing times, I don't know, 4,000 or 5,000 is a lot of money.
It is a lot of money. I didn't think about it that way. Anyway, yeah, I'll work on that. I'll talk to E-Rock. Maybe E-Rock will take it because I'm sure Ange doesn't mind that he has a basement full of action figures and pop
she
figures.
Would be
and
so
Can you
mad
imagine?
At you.
All right. Well, by the way, I am now a COVID-19 vaccine trial participant. Yeah, I'll give myself one of these. And Tacey's going to do it too, but she wanted to wait to see if I die first.
Well, yes.
So, and I think that's smart. Back in the day, we used to think about taking separate planes to go places in case one of us went down. Now we just take the kids with us, so we'll all go down together.
All go together.
But, yeah, I think that's smart. So, yeah, I got it today. It was a pretty professional deal, as you would expect. This is a Pfizer study, and Pfizer's doing the study for a company called BioNTech, and it is an mRNA vaccine. And the mRNA vaccines are a lot easier to make than the others are because you don't have to grow something in cell culture. You can just make these RNA. Once you get one strand, you can just amplify it. There's a machine that will just take it and amplify it and make more. And I know we've talked about it before, but for people who are just now listening who don't know what it is, instead of injecting a protein like you do, say, with influenza that the body then recognizes as foreign and makes antibodies to, you're injecting the instructions to the cell to make the protein. So mRNA is just a set of instructions. It's like a deck of computer cards or just a computer instruction. And it's a set of instructions. This is how you make this protein. And so it inculcates itself into the cells. And then the cells just go, okay, here's a couple of ribosomes. Let's put them on there and some transfer RNA, and we'll just bing, 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 and we'll make this protein. And then the protein gets expressed on the surface of the cell, and then the body then recognizes it as foreign and makes a humoral and cellular immunity against that protein. And it acts more like an infection because these proteins, instead of just floating around, are actually on the surface of the cells, just like they would be if a virus was making them. So it's pretty cool. And I'm very excited about it. And I have a 50% chance of having a placebo, but I'm pretty sure I got active vaccine because I'm already starting to feel a little bit of myalgias and some pain at the site. Yeah. So there you go. So we'll see. And they give you anybody that wants to do this, by the way, just check and see if one of your local research facilities is doing this. They pay you for it, and you get a little app, and you have to check in once a week and tell them how you're doing. And they every time you check in on the app, they give you a little bit of money on your card too. So I mean, it's a way to just get a little bit of walking around money.
Walking around money's good.
Yeah, so I'm very excited. I promised our listeners that the second that this crap, came to our area where I could do it, that I would be the first to volunteer. And I wasn't the first, but I was among the first. And because I want to do this, I'm so sick of this that I'll do anything I can to make it in. I even told them, if you want to do a challenge trial, spray COVID-19 up my nose in a week and we'll just see. Because that, of course, would accelerate approval of these vaccines if we could get a cohort of people where they do a challenge trial. And why is that? Well, because even today, how many cases do we have in this country now? 5-6 million? That's, what does that work out to? Like 5% of the population, if that. And, or is it like 2.5% or 350 million people? Anyway, 7% would be 5%, right? So when we have such low numbers, the vast majority of people aren't going to get it. If you have even at 5%, 95% of people aren't going to get it. So you vaccinate 100 people and none of them get it. You haven't said anything, because there's a chance that any random 100 people will never get COVID-19. So, they have to vaccinate a ton of people. Now, if you took, let's say, 200 people, vaccinated them, and shot COVID-19, SARS-CoV-2 up their nose, you could get excellent data right away. Then if nobody got it, you could say with some confidence that this vaccine was effective. So,
Steve, I keep hearing of people who are diagnosed with COVID, and then they just don't get better. But then, month or 5 weeks out, they're not testing positive anymore, but they're still just sick. Is that virus just rampaged their body? I mean, is that what's going on with that?
Sure. So there are these ACE inhibitors all over the body, or not ACE inhibitors, ACE receptors all over the body, and the virus can cleave to any of those ACE receptors. There's a ton of them in the nose, but there are some in other parts of the body as well. Plus, the inflammation that this novel virus causes, because of the body's immune response to it, can cause damage in the blood vessels, in the heart, in the kidneys. And so you can clear the virus, and if you had a really vigorous inflammatory response, you could still be pretty sick afterward. So that's where a lot of that's coming from. Now, there was one person that got reinfected that they're pretty sure was a true reinfection, not just a couple of false negative tests, and then they had a true positive test. And apparently that person actually did get pretty sick. The vast majority of data that I've seen on people that have tested positive a second time have not actually been symptomatic. So we'll just have to see if that was a fluke or if there's a trend there. There could be a small number of people, and it will be vanishingly small, that if they get reinfected, they'll get sick again. But, that remains to be seen. We only got one case now, so we don't really know anything.
Okay.
What'd you hear? Yeah, go ahead.
Well, I have an article.
Okay.
This one is actually interesting, everyone.
Okay, yay.
It's from the Annals of Internal Medicine. And it talks about fecal aerosols and the transmission of severe acute respiratory whatever.
Just say COVID-19.
COVID-19 has been suspected.
Yeah.
So farts.
Yes.
Farts.
So fecal aerosols would be flatus and sharting, basically. And we talked about this before. And are you sure that was not the Annals of Internal Medicine? It was a parody site?
I don't know how to say it.
It's the Annals of Internal Medicine.
ANNALS.
Of course.
You know what? You want to be a smartass? Do the show yourself.
I'm not talking about that. I'm talking about, I was making a joke about their fart. Ugh.
I just now got it.
Okay, you got it. Okay, thank you.
But I'm just so used to being made fun of.
I don't ever make fun of you. But anyway, so they have postulated for some time that because this virus is swallowed, that it can make it through the GI tract, and you can detect viral RNA in stool. Doesn't mean that it's infectious. Just because you can detect the RNA, if it's naked RNA, it can't do anything. Or if it's viral particles that have some RNA that's at the threshold that you can detect it, again, you can't get infected by that. And we have talked about the toilet plume, where when after defecating, you flush the toilet, and then there is a plume of fecal particles and aerosols that hit the air. Now, if you had an infectious viral particle in that plume that could be transmitted by inhaling it, then yeah, in theory, you could get a disease that way. And also, the conditions that I came up with that you would have to infect someone through flatus would be these. Number one, that the virus has to make it through the GI tract intact. Again, just because you can detect the RNA doesn't mean that can infect you. So it has to be intact. So that's the first condition. Second, you would have to be extremely close to someone when they pass gas, because these are not viruses aren't gases. Even the nanoparticles themselves are heavier than a gas, because the molecular weight of a virus is huge compared to, say, hydrogen sulfide. So just because I pass gas over here and you can smell it doesn't mean that a virus could travel that far. Okay.
Are there any conditions that you can get from?
Yeah, so that's where I'm getting to. So if you crouched down behind me and I bent over and I blasted one right in your face, and the first condition was met, that I had live viral particles in my rectum, I could conceivably, under those conditions, infect you with SARS-CoV-2. So other than that, again, we get to that bell curve. This is so many orders of magnitude away from the mean of droplet transmission that it's, we might get one or two maybe, but to my knowledge, there's not been a single case that's been attributed to fecal aerosols, but I'll keep my eye out for those. Now, somebody accosted me online and said, well, you were wrong about the aerosol thing. No, there have been aerosol transmissions, but some of these articles that are talking about aerosols are conflating droplets and aerosols and just saying that aerosols are really small droplets. So you have to be careful how you define these things.
So what's the difference?
Well, if you have a true aerosol that can sit in the air, that's not the same thing as a small droplet. Okay, you're talking about misting something. Okay. And so it really has to do with particle size. And you can define these things. There's a range. There's not really just one cutoff. Well, this is a droplet and this is a particle from an aerosol. And so depending on how you define that, you can come up with different answers. But they're really all the same answer. They're just defining those terms differently. Okay. Anyway, so let's talk a little bit about the CDC. I thought a lot of people would call in about this, but they really hadn't. Where have you seen on your Facebook or Twitter? Well, you're not on Twitter, but on your Facebook, where people have said, "Oh, see, this is proof the CDC is covering stuff up."
Yes,
they very quietly,
that they're misrepresenting.
They very quietly ratcheted down their death rate to say only 6% of people actually died from COVID-19.
Yes, explain that, please. Okay. I have an article pulled up right now.
That claims that, or do you have one that refutes
it? It asks the question.
Okay, ask the question then.
Did COVID-19 cause only 6% of the coronavirus deaths?
No, that's incorrect, and here's why. So people are using this to say, well, this is no big deal. It's nothing. It's the CDC even admits it, because they just said that only 6% of all these deaths were actually caused by COVID-19. That is not what this. We dealt with this. I dealt with it on the COVID Sit Rep on our YouTube channel at the Laugh Button YouTube channel, and I've dealt with it on this show before. When this report comes out, people freak out, and then it goes viral. And it's the same thing every time. That, they're quietly revising their estimate. That's not what happened. This report that they're talking about, and I actually don't have a problem with people that are spreading this around. I have a problem with the CDC because I even wrote to them and said, your messaging sucks on this. This is a specific report called the Provisional Death Report. And this provisional report is based on death certificate data. So when you write a death certificate, it goes into a database, and then they have this database. And of those, all of the death certificates that listed COVID-19 as a cause of death, only 6% of those said COVID-19. Now, here's how we do death certificates. So everybody needs to understand this. The death certificate will have 4 or 5 slots, and it's the same in every state, that says they died of this, due to this, due to this, due to this, due to this. So you can say many things. So you could say the person died of sepsis due to urinary tract infection due to bladder outflow obstruction. Okay? So someone has COVID-19 on Wednesday. They get viral pneumonia on Thursday. They get respiratory failure on Friday, and they die on Saturday. So this is how I would do the death certificate in that person. Number 1, they died of respiratory failure due to viral pneumonia, due to COVID-19. Now that death certificate, that person obviously died because they were infected with SARS-CoV-2, right? But the death certificate is not going to be in that 6%. It's going to be in that 94%, where it didn't just say COVID-19. Now, my argument is that 6% that said COVID-19 by themselves, whether you get a death certificate, what they die from, COVID-19.
That was lazy work.
It's
right?
not only lazy. Yes, it's worse than lazy. It's incorrect. It's incorrect because it's lazy. So you're absolutely right. It is, no one dies of COVID-19. They die because of what COVID-19 does to the body. And when that happens, you're supposed to enumerate that on the death certificate. Some people are dying of respiratory failure. Some people are dying of shock. Some people are dying of renal failure. Some have strokes that are caused by, the inflammation caused by cytokine storm that was caused by COVID-19. Those are all deaths that can be attributed to COVID-19, but will not be in that 6%. They'll be in the 94%. And when you look at that report, it specifically says, I think the number 1 cause was respiratory failure. Well, that was caused by the COVID-19. So there's no quiet ratcheting down. There's no conspiracy here. That's just crappy messaging by the CDC. And that number should say 100%, and that 0% of death certificates should only say COVID-19 on them, And people are saying, well, it's just people with pre-existing conditions. Well, yeah, I mean, if you have no pre-existing conditions, literally, at my age, don't know anyone that doesn't have a pre-existing condition right now. At least everybody, all of my friends either have high cholesterol or they've got stage 1 hypertension or something like that, And
or even in their 40s. Even in their 40s,
sure.
People have pre-existing conditions.
Now, is this, should we shut everything down and put everybody out of business? Because no, I think that I definitely agree with the people that say we should be protecting the people who are most vulnerable and protecting our hospitals from overwhelming the system, so that people who have an appendicitis and otherwise would die if they couldn't have surgery can get into the hospital. It's not full of COVID-19 patients, and the hospital isn't shut down to all other comers. Because in that situation, people will die, but it won't be just the COVID-19 people. It'll be the people with heart attacks and surgical emergencies, compound fractures, trauma, and stuff like that can't get into the hospital. So that's why we're doing this. So we have to protect the vulnerable. That, by the way, that's me. Thank you. And we have to protect people with, and so I'm careful. I'm not going to, concerts and stuff like that. I'm okay with them having even crowds for certain populations of people. Although, if you're 20-something and you think you're completely immune from dying from this, you got another thing coming, because although you're in the lowest risk group, the risk is not zero. Let's just look up COVID deaths by
even
age.
Colleges, Steve, they're just...
Yep. Oh, and the worst thing that these colleges can do, though, is when they get a dorm that's full of people with COVID-19, is send them home.
Oh, yeah.
Because then they're not only taking it home to their parents, but they're taking it. They're spreading it geographically. You remember that video we watched early on in this, where they had all those people at spring break and they were tracking their cell phones, and you could just see it spread across the country. And that's what would happen. So if they get an outbreak in a college, they need to shelter in place. So let's see here.
But they're not, though. They're not sheltering in place.
Are they not?
Well, I don't know what they're doing with the infected, but I do know that a lot of people are just going home. Yeah.
Well, I have issues with that. But okay, so if we use 18 to 29-year-old as the comparison group, then if you're 5 to 17, your rate of death is 16 times lower. Not 16%, 16 times lower. And then if you're 30 to 39, it's 4 times higher. 40 to 49, 10 times higher, and 50 to 64, which is where I am today, 30 times higher. But guess what happens 12 days from now?
Yeah.
It goes up to 90 times higher. Mm-hmm. Now, that's one of those weird, disconnects where one day really isn't going to make any difference, but that's just people in that group. And but those are relative numbers. Let's see if we can get absolute numbers. Absolute numbers, deaths from COVID-19, 65 to 74, 12,766. This was just, what is this? Let me see. That's weekly updates. Okay, here we go. Updated August 26th. Deaths involving coronavirus, pneumonia, and influenza. Okay, and influenza. Let me see. Okay, all deaths involving COVID-19 in ages under 1 year, 17. 1 to 4 years, 12. Let's look at 15 to 24, 280. And 25 to 34, 1,257. And that's out of 88,000. So your chances are about what? 1 point something in 88 of dying if you're in that group. So, the odds aren't zero. That's a crap load of tragedies.
Yeah, it certainly is.
And yeah, it's not as tragic when I die. Because
no, it is. I had an acquaintance, a very mild acquaintance, but a friend of mine just died today. And
how old were they?
They were older, but they were retired. They were living the life that they've always dreamed of.
Yeah, I'm never going to retire. I'm just telling you that right now. Everybody I know that retired, something bad has
especially
happened to
physicians, they retire and they just drop dead like flies. But they're living the good life, the life they'd always wanted. And then here comes this virus, and I saw him a couple of months ago. He was absolutely fine, and he got it, and it just got him.
This is one of the people that you partied with when you were down there?
This was when I went in May. No, it's not.
Okay.
Not of the fire pit.
Yeah. Okay. Wow. Yeah. So out of 88,716 people in my age group, there was about 34,000. So about a third of the deaths were in my age group. And so anyway, all right. So the CDC is nothing if not mostly transparent with data. They may be shady on some things. You can make that argument. I'm not making that argument. I think if we can't trust the CDC on things like this, then we are in worse trouble than we think. But they're not ratcheting down numbers and quietly putting it out there. If they want to cover it up, why put it out? You know, this report comes out on a very regular basis, and every time it comes out, I see these tweets. So, all right.
Yes.
Does that make sense?
It does.
Did I explain that well enough?
Thank you for going over that, because I'm sure with all the really smart people at my gym, I'll be hearing about it today.
Okay. Well, then you'll know. You'll know what to say.
I'll probably just ignore them.
All right. You know what? I didn't download all the voicemails, so we've got some doozies.
Good.
Well, that's okay. So we'll literally take 1 second to do this. Let me see here. Oh, yeah, we got some good ones in here. We've got one on Barrett's esophagus that I'm going to need you to because you're my Barrett's expert. So let's see here. Sorry, everybody.
I am not a Barrett's expert.
Well, you know more about it than I do.
No, I don't.
Okay. All right. Well, okay, I know more about it than you do, but I wanted to give you something to talk about, so let's go.
I don't need to talk.
Okay, you're fine.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Let's see what we got.
What's up, Dr. Steve? How are you doing? Just wanted to call and ask about alkaline water. I bought this water today that's like pH 8.8, and I remember you saying a while back that we can't really change the basic or acidic levels in our body. They always maintain like a really tight margin. So I'm just kind of wondering what the benefit of all this is, and if there really is one, or if it's more mumbo jumbo.
Yeah,
Steve,
thanks a lot, man. Take it easy.
That's a great question, because I know a lot of herbalists. Oh, I'm going to get so much trouble with Scott right here. Well, just,
he's not an herbalist.
No, natural.
Yeah, naturopaths.
Yes, who talk about the acidic level of your blood. Is that possible?
Nope.
Okay.
So if you come in to me and you have, so your pH right now is 7.4, barring that you're hyperventilating and you can run it up, or barring that you have some other issue. Drank a bottle
of wine last
night? Well, no, that should still be okay. Your pH is 7.4. Everybody that's listening to this, unless they have a condition, their pH is 7.4. It's very tightly regulated by the body. Now, if you take in alkaline water or acidic water, which you do like if you drink lemon juice, okay? What happens is the body detects this change in your acid-base balance, and it moves to correct it. And so you will pee out. If you drink alkaline water, you'll pee out alkaline urine to get the body to return back to a pH of 7.4. You can hyperventilate and get your pH up to about 7.5, and that's about it. Now, there are some benefits to doing this, but they all have to do with your urine. So There are kidney stones. So when you have uric acid and cysteine, calcium oxalate stones, they form an acidic urine. Okay. Struvite, those are magnesium and ammonium phosphate and calcium phosphate stones, form an alkaline urine. So if you are a person that's prone to making struvite kidney stones, and how would you know? When you get a kidney stone, you take it in, have them analyze it. Then doing what this person's doing will make them worse, and they will rue the day that they drank that stuff. Because it's just, you remember in chemistry, you would put some stuff in solution, then you might add a little acid or base to it, and it would precipitate out. That's what's going on here.
My chemistry teacher, my organic chemistry teacher, actually did all my experiments for me because I couldn't figure it out.
Well, and because you were hot and with the big boobs.
I got a C, though.
Yeah, you did? I'm still pissed about this. The one A- I got was in a lab, and it was a chemistry lab, and there were these two women in there, and they were extremely attractive, not unlike yourself. And the TA, the chemistry quote unquote professor, he was a doctorate student, had the hots for them. So he was always at their table doing their experiment for them. And when the thing was over, I got an A-. It's like, I turned all this stuff in. All my results were perfect within tolerance. He said, I know, but they only allowed me to give 2 A's. And so I gave it to these two. And so I had to give you an A-. So that took my average from 4.0 to 3.99999. I was so pissed. But anyway, bastard.
Sounds terrible.
Yeah, so when you tell me that story, that just gets it all going again, because your chemistry professor was trying to do the same thing. He was trying to make time with you. You think he would have done that for me if I couldn't? Oh. Excuse me, I can't do my... Oh, I'll be right there and help you, my young man.
I really think he just felt sorry for me.
Yeah, and it's easier to feel sorry for somebody who's hot with the big boobs, too. So I'm just saying. Okay. But anyway, all right? Mm-hmm. So whether I'm right or wrong, we'll never know. I'm sure he was just very altruistic and helping you out, although you could argue that's not helping you by doing your project for you.
No, it helped me because I've never used it, nor will I ever again.
Okay. Well, anyway, so urine, yes, you can change the pH of your urine. You can transiently, by maybe 1/100th of a point or something, change the pH of your blood by drinking something, but the body will immediately react to return you to a pH of 7.4. So any other claims that are made for this are not substantiated in the medical literature, and it would be easy to know. And so, okay, I'm going to cure cancer with alkaline water. That's the easiest thing in the world to test, right? How would you do that? You've listened to this show long enough.
No, I haven't.
Okay. So I will tell you then, because this is what I know Tacey would say if she weren't shy. You would take 1,000 people who have cancer, and this is an unethical study, by the way. 1,000 people who have cancer, and you give them alkaline water. Now, I could make it ethical by giving them standard treatment at the same time. Okay. So let's just say we're going to do it in kidney cancer, because that makes the most sense, because, the kidneys are at least involved in pH balance. And so you take 1,000 people with renal cell cancer, and you match them by stage, age, risk factors, all that stuff. And you give them alkaline water, and then you take another 1,000 people and you match them the same case by case, if you could, the best you can. You want to try to find clones of the people that are in the treatment group. And you just give them the regular treatment. They all get the same treatment, except one group gets alkaline water, one gets regular water, and they can't tell the difference. You can, if there's a taste difference, so you put Crystal Light in it, do whatever you got to do. And then at the end of it, you decode it. I don't know which one the people got. They don't know. And follow them for 5 years. And if at the end there is a statistically significant difference in favor of alkaline water, hell, we'll give everybody alkaline water. This will no longer be a controversy. That's how you do it. The reason there's a controversy is because they don't want to do that. They just want to make claims for this stuff. You know, they don't, because they know that if they do the double-blind placebo-controlled study and it works, there's no skin off our nose. Hell, we'll start using it. But if it doesn't work, they're out of something that we don't do. You know, so that's the sort of logical fallacy that the people who are proponents of whacked out pseudoscience stuff. Now, we can prove that it's not whacked out pseudoscience. Yes, I have a bias. I wouldn't be the one to do this study because I am biased against it. But I'm open-minded enough to accept the results if they do a good study on it. All right? So, let's see.
Dr. Steve, how many of our questions do you research beforehand so you can give us a fully fledged answer versus
when do I ever give a fully fledged answer to anything?
Just digging out of your ass whatever answer you can pull up out of whatever you learned in med school? Thank you, Dr. Steve.
Well, that's why we say don't do what
that's right.
you say.
Thank you. Here.
Give yourself a bill.
Yeah, don't do anything I say because I am mostly pulling these things out of my, ass crack for real. And there's about 10% of questions that when I get out, it's like, ooh, that's interesting. There have been a few questions that have been asked where I said, no, that's complete horse feces. And then but I'm going to do some research before I say it. And then I find out that no, in fact, there really is something to this. I can't think of any right now, but longtime listeners will remember the few times when I said I thought this was complete bull and it turned out to actually be something. So I learned things from you guys asking questions about particularly some of the more offbeat stuff. So anyway, there you go.
That was a good question.
It was a good question.
Hi, Dr. Steve. When I cook, I like some of my foods pretty burnt. Some of my vegetables, hot dogs especially, which are not vegetables.
Yeah.
But just char really well sometimes. Possibly excessively. Now, there's ideas that these could be carcinogenic, and this might not be ideas, it might be real, but as for the vegetables, how much nutrition am I possibly leaching out of the vegetables by cooking them possibly too long? And maybe some stuff about the carcinogenic hot dogs too. Thanks, Doctor.
Okay. Yeah. Let's talk about the vitamin or the nutritional value. So there are some vitamins are what we call heat labile, meaning they can be broken down in the presence of high heat. And interestingly, the fat-soluble vitamins are less likely to be broken down in the presence of heat. And so the mnemonic for fat-soluble vitamins is ADEK, A, D, E, and K. So vitamins A, D, E, and K are fat-soluble. Those are the ones also that you can get in trouble if you megadose. Because they're fat-soluble, there's a reservoir of them in the body in the fat cells. And all the other vitamins, C and all the B vitamins, are water soluble, and so you're going to lose some vitamin C. You'll lose some B vitamins if you're just charring the outside, as we did this weekend, Tace, when we made street corn.
Oh,
how awesome was that?
Yummy! That was so good.
Let me just talk about street corn for a minute because I'm just jonesing for it again.
We'll need it this weekend.
So you take a fresh ear of corn. And what I did was I did something from Sam, the cooking guy's YouTube channel, was I took melted butter and some chili powder, mixed it up, and then I brushed it on the corn before I put it on the grill. And then you put it on the grill on high and then just be turning it and watch it. And you want to just very lightly char some of the kernels, not all of it. You don't want the whole thing just burnt. But you want it charred some so it looks more like what they used to call Indian corn, where it's got lots of different colors. And then you take it out and you slather, and I mean that in the truest sense of the word, a mixture of mayonnaise, 1-to-1 mayonnaise and sour cream. Now, I've seen some recipes where they just do the mayonnaise. A little, what's the charred pepper? Why am I having chipotle? Some chipotle powder and some chopped up cilantro and a little bit of garlic, and you mix all that up, and then you just slather that on there, and then sprinkle some cojito cheese if you don't have that, feta cheese, and then just eat the hell out of it.
So good.
Now, what Sam, the cooking guy, did, what got us interested in this, was he made a street corn hot dog, where he took a hot dog and put it on the griddle and wrapped it in bacon, and then just cooked it, and it got all plump, and the bacon got cooked, and then he stuck that in a toasted bun with some of that butter with the chili powder on it, and then poured the corn all over it. Cut it off the cob, and oh God, that was good.
Oh yeah.
So anyway, what were we talking about? Charring stuff. When you char things like that, you're not burning it all the way through. So some of the nutrition will remain, particularly if you're just charring the vegetables on the outside. There will be some on the inside that will remain. But vitamin B1 is the most susceptible to thermal degradation. It's the most heat labile. So, and then onto his nitrosamine question, which is really what that is. He's talking about charred meats. When you char stuff, you can generate some nitrate byproducts, and one of those are nitrosamines. Let me look up charred meat really quick. Charred meat and cancer. I'm looking this up on pubmed.gov. And here we go. So meat-related compounds and colorectal cancer. Now let's look at that. Let me see. See, talk about pulling it. Okay, here we go. There we go. Colorectal polyp type and the association with charred meat consumption. So consumption of greater than 3 servings of charred meat per week was associated with HPs. What are they saying an HP is? It's some kind of polyp. Where is it? Oh, hyperplastic polyps. Okay, that's not that big of a deal, but not adenomatous or other types of proximal polyps. So a hyperplastic polyp is just one that is benign. It just grows out of the mucous membrane of the colon, but it's not precancerous. Heavy cigarette smoking was associated with an increased risk of colorectal adenomas. So, we say quit smoking at the end of every show. I'm 25 years sober now, I think, something like that. Let's see. And that no association with anything else in this particular study. So, charred meat has been looked at for gastric cancer and some other things. Let me see here. But, I don't have a whole lot. Maybe we could do something on that next week, Tace, because we're still in grilling season. Will you leave me a note to get some data on charred meat? We
were supposed to do something on something else last week.
Yeah, I did it on the podcast, so too bad. Okay. But anyway, yes, there is some association that's been suggested in the medical literature, and then you'll see another study that says no, we don't think that there is. I've seen the same thing with cured meats, where a high cured meat consumption was showed increased cancer. And I saw another meta-analysis later that said, that brought that into question. So let's do all of that next time. We'll do that as an opening discussion. Okay.
Okay.
Be something other than COVID we can talk about. All right.
Hey, Dr. Steve, this is Gary in Oklahoma.
Hey, Gary.
Just read the news this morning. Chadwick Boseman passed away from colon cancer at the young age of 43. With a colonoscopy supposedly not being recommended till 50, what the hell?
I know. Yeah, no question about that. What the hell indeed. Same thing with Frank Zappa dying of prostate cancer in his 40s, here's the new guidelines is 45 to 50 for your first colonoscopy, unless you had a first-degree relative that had colon cancer, and then you go 10 years before that, so whichever one is earlier. So if you had So like Chadwick Boseman, this really made me sad. I loved that guy.
He was awesome.
He was such a good actor. I've seen him in other stuff other than Marvel movies. He was so great in the Marvel movies. But, I loved him in that Thurgood Marshall movie, and he was insane as James Brown. I mean, he was just a brilliant, brilliant actor and had so much going for him as an actor. We were going to be seeing him for the next 40 years acting, and I was very, very sad about that. And he just seemed like just a great, just wonderful person. So he's 43. So his kids need to get their colon cancer screening at 33, unless there were other extenuating factors. For example, if you have a history of familial polyposis, which is a disease where people are at high risk of getting colon cancer because they got just a countless number of polyps in their colon, they're getting their colon screening every year. We have a friend that has that, and he has to get colonoscopy every year. And he was the one that convinced me to have my colonoscopy without anesthesia, which I also wrote about. If you're interested in learning about that at all, I wrote a big, long thing. I put it on Quora, too, but it's on our website at drsteve.com, along with Tacy's one-page baby manual for new parents. Just in the search bar in the upper right-hand corner, just put in colonoscopy, and it'll come up, the dreaded colonoscopy. And I wrote a somewhat humorous article about having a colonoscopy without anesthesia, and it's not bad. But the other thing is, I had another friend of ours ask me, well, damn, Chadwick Boseman was young. What am I supposed to do? I'm not 45. I don't have a family history. If you have any symptoms at all, they will do a colonoscopy on you. And you can get screening colonoscopies done pretty easily because of the Affordable Care Act. They're covered under that. That was one benefit of the Affordable Care Act, was covering preventative screening stuff. But if you have any symptoms at all, change in your bowel habits, dark stools, blood in your stool, painful defecation, any of that stuff will buy you a colonoscopy if you're really worried about it. So just talk to your primary care provider, talk to your gastroenterologist, see if you need a colonoscopy. But this is, again, it's like, why, when I'm 64, which I am now, is my risk of dying of COVID 30 times more than a 20-year-old? But 2 weeks from now, it'll be 90 times more. So we're making these artificial cutoffs. So at 44 and 364 days, you're not eligible for a colonoscopy, but at 45, you are. Mm-hmm. It's artificial. So it doesn't matter what age we set it at, there's going to be someone that doesn't meet those criteria that's going to die, that we should have, or could have caught it if we had ratcheted down the criteria. So there's a risk-benefit to society kind of thing by doing that. But this was a tragedy. I wonder if he had symptoms before it happened. I wondered if he had family history of early colon cancer. Or was this just one of those tragedies that couldn't have been avoided no matter what you did? So, all right. Check your stupid nuts for lumps. Testicular cancer is a young man's disease, and young men are rarely told about that. Quit smoking. All we can do is mitigate risk. Wear your stupid seatbelts. Have Narcan in the house. In 2020, I think every home should have Narcan. Every home should know the Heimlich. We saved our kid's life when he was 7 with the Heimlich maneuver. Everyone should know CPR. They should wear their seatbelt. Not because I think you're going to have a wreck, in case you do. And I think people should have Narcan in the house, too. If you don't know what that is, it's a narcotic antidote for people who are overdosing. You're going to know somebody in 2020, in the next 10 years in this environment, that's going to die of an opioid overdose, either from prescription medications or because they can't get them anymore because the doctors aren't writing them like they once did. And now they're dying from fentanyl imported from other countries. And you could save somebody's life. Don't be Walter White, and when somebody's dying of an overdose, you just sit there and watch them die.
It, yeah.
Right, okay.
So how do you get Narcan in your house?
You can ask any healthcare provider to write your prescription for it, and in some states, they're just giving it away.
Okay.
Some pharmacies are giving it away.
Look, we ended on a good note.
Yes, we did. A very hopeful note.
That.
You can save someone's life. All right, and I'm going to ask everybody to remember stuff.drsteve.com for all your Amazon needs. Just click through, use it. It really helps keep us on the air. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, Lewis Johnson, Paul Ovcharsky, Eric Nagel, Roland Campos, Sam Roberts, Pat Duffy, my niece Holly, Dennis Falcone, Matt Kleinschmidt, my niece Chrissy, who is helping me out with my voice stuff. Dale Dudley, the great Rob Bartlett, Ron Bennington, and Fez Watley, whose support of this show has never gone unappreciated. Listen to our Sirius XM show on the Faction Talk channel. Sirius XM, channel 103, Saturdays at 8 p.m. Eastern, Sunday at 5 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks go to our listeners whose voicemail and topic ideas make this job very easy. And go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye, everyone.
Goodbye. Thank you, Tacey.